Hello, welcome everyone. As we already said that we are going to start a new session where I'm going to put and drug in a mixed and miscellaneous from a mixed and miscellaneous books, particularly from Allen, Body, Kent, Farrington, and all those books, and try to create a picture of a drug or medicine so that it can be better understood. And I will try to make video in English or in Hindi or in a mixed way so that it is bitterly understood. So the first drug we are going to discuss about is Abrotanum. As we have already seen that Abrotanum we have read from Alan Skinner in different language and in from Kent. Now I have tried to understand Abrotanum from different authors' perspective and their clinical notes so that the picture is a bit clear and we can prescribe it in different patients. So let's begin. As we all know that in homeopathy, uh, the system holds a different degree. That means homeopathy more towards it do not consider only science, it also have philosophy. The problem with us have that the modern medicine, the root of modern medicine inside of us really basically restrict us in understanding the philosophy part of the any aspect. Now homeopathy deals with both. It is in a way of modern medicine and in other way it is a philosophy. Now the main thing of homeopathy is that it try to understand the symptoms and its the origin. And in modern medicine and in homeopathy, both is a system of medicine which tries to understand the root of the disease. And the root of the disease in both systems are quite different. The modern medicine deals with the scientific aspect only, but in homeopathy, we deals with scientific and philosophic aspect, both side. Now, when we are in scientific aspect, we believed in the evidence-based medicine. That means there must be something in medicine and there must be something in diagnosis, and then we can match them and then we can cure them. But in homeopathy, it is quite different. The classifications of the disease is quite different. The understanding and the origin of disease is quite different. Their philosophical standpoint are quite different, and along the case taking formats for homeopathy and modern medicines are quite different. Homeopathy relies more on the taking of the history, and that is the symptoms, whereas whereas the modern medical system uh, along with the importance of taking history, they more rely on the instrumental or technological advancement as well as their medical approach. So, the difference between homeopathy and allopathy remains arguably as debated, but our master, Dr. Samuel Hahnemann, has tried to make us understand homeopathy in a simpler manner, and he have given the classification of disease in simply two acute and chronic format. And I have already discussed that in chronic disease the origin would be very small, often imperceptible. That means patients will face very difficult to say how the disease actually started. And the concept of chronic disease is that its origin is very slow, but its progress is very gradual, and eventually it kill the patient. And not only it kills it, it also goes generations to generations, and that is the main problematic. And in homeopathy we call it as constitutional pollutions, and that pollutions goes from constitutions to constitutions, and that is simply called as miasm. Okay, so it is the chronic disease, and in the acute disease, we all know it is sudden onset and it eventually kills the patient within a few months, and or it leave the patient in a proper health without medicinal help. So based on these two different classifications, every medicines we must try to understand in both different way. That is its prescription in chronic format and its prescription in acute format. So every medicine, if you see, there are basically two types, and we all know that basically there are two types. One is particular symptoms and other is general symptoms. Particular symptoms and other is general symptoms. So, as per Dr. Kent, we have known the general symptoms further classified into mental and physical general. So, now general symptoms represent the patient's health as a whole. Now, when we are trying to cure any disease, chronic disease per se, we must understand the general symptoms. We must take the man as a whole rather than the disease only. Whereas in case of particular symptoms, I have already discussed that we must take the symptoms in a complete way. That is the location, sensation, its different modalities, how it aggravate and or ameliorate, and its concomitants. Though taking concomitant symptom is a bit tougher. Okay, so let's see. Today, the first drug of our discussion is abrotanum. Now, as I have said that the constitution first, so what a abrotanum person as will appear to you, which needs to consider in chronic diseases or chronic cases. See, the person's appetite is good, the ravenous hunger, often gnawing hunger pain, vomiting, and feels as if stomach swimming in water. The patient may feels like his stomach is swimming in the water, or he may feels gnawing hunger pain with some vomiting. These might be the symptoms of the patient, but the hunger is, remember, it is ravenous. That means patient has good appetite, huge appetite. Next, but the defective digestion, miasmatic, pathologic, tuberculous peritonitis, as Boric suggests, or any functional disease. So it means patient have good appetite, but its digestions are defective. Maybe there is problem in assimilations or maybe indigestions. Patient cannot digest the food. Why? Maybe there is two reasons. One is miasmatic or other is pathologic. Maybe there is some pathology going on inside his bowel, or there are miasmatic. Miasmatic means, as I have suggested, there may be any constitutional disease that he or she has inherited from the past, inherited from his previous generation, and maybe that can be diagnosable or not. We do not know all types of diseases. So maybe there is a constitutional, maybe there is idiopathic basically, or it may be a pathology. Maybe there is some kind of disease like tubercular peritonitis, as Boric suggests, or any functional disease. Maybe there is only symptoms, no pathology as per se. So patient has good appetite, but there is defective digestion, maybe any due to any cause. So hence there will be a malnutrition particularly, and followed by an emaciation. Patient will gradually lose the muscle mass. But the peculiarity is emaciations over leg markedly and skin flabby and loose. So there will be emaciations, but as per Kent, here you say, in abrotanum, emaciation smart and starts from the lower extremity, lastly affect the face. As Kent suggests, the emaciation starts from the lower part of the body, just opposite to we have seen in lycopodium, in sorinum. It starts from face and goes downward. That is the differentiating points. So the emaciations starts in abrotanum or in ectramure from the lower part of the body. Sorry, in abrotanum in the lower part of the body, and then it gradually ascends. Now, watching this is very difficult. So patient may come in the initial stage or in the latter stage where the complete emaciations has taken place. But you have to find out with the history. And last point is the mentally child is cruel. So the cruel is the important point. The child is cruel. So it is also, I have already discussed in the Allen's keynote, the child is cruel. So this is the constitution. The patient has a good appetite, but he cannot assimilate or digest, and because of this, his emaciation started, and the peculiarity it started from the legs, and mentally the patient is very cruel. So these are the conditions we must understand before considering a chronic case of abrotan. Next, see the particular symptoms. What the particular symptoms is, that means what are those symptoms that the patient will represent. Number one is child is cruel with good appetite, unable to grow with lienteria. And with lienteria means we know that undigestible, undigestible food particles through stools. As we all know, stool is undigested food. But if the food the patient has taken coming as it is or slightly morphed in his stool, then we call it as lienteria. That means it is an old term. That means whatever the patient is taking, only 10 or 20% is digested. Remaining all goes through the stool. So patient stool character is like that. Second point, so this can be a particular symptom. Second is, and also patient has a good appetite, but there is no muscle mass. Second is dysentery, piles, or any parectal bleeding or other abnormal secretions checked, and rheumatisms or gout starts or alternate. Very important symptoms we have seen in case of any. This is also known as metastasis. So metastasis is nothing but alternating the progression of disease in a different format. It first affects an organ and then goes to the different organ direct with the direct pathology or with the indirect pathology. So patient had dysentery or had piles or had any abnormal discharge or had bleeding, parectal bleeding, maybe due to tuberculosis peritonitis or anything, but suddenly this get checked or by suppression or by suppression, as our body suggests, any any chest discomfort, okay, suppressed, or any rheumatism suppressed, and then the discomfort in chest started, okay. Similarly, if there these symptoms are checked or suppressed and they metastasis into the joints and they create rheumatism or gout like symptoms. So this can be thought this is very important symptom in case of abrotanum. So Kane goes further and says along the disease course the patient's rheumatism gradually may affect heart, so that can be rheumatic fever. So then symptoms like heart irritations with rheumatic complaints and abnormal discharge, that is diarrhea, etc., or periodic bleeding may alternate. Okay, so same things. Third point is more dynamically this can be represented as alternate colic and limb pains. It is not necessarily that patient will come to you and say that there is parectal bleeding there or there is hemorrhoids, but when it stopped, I have joint pains. But patient initially or functionally, when there is no structural disease as per se, can say I have pain in my abdomen, and there is suddenly after few days there is pain in my leg or cramps in my leg. So these are the symptoms can be functionally or very dynamically represent. The patient can bring these type of symptoms. Okay. So as we all know, colic is a spasmodic pain caused by contractions of hollow organ, mostly abdominal organ. Hence, colic usually thought of abdominal pain, but remember, not necessarily. So colic means any abdominal discomfort. Okay. Or any abdominal hollow organ pain. Okay, okay. Next, come to the part that is the important point, that is the metastasis. We have already discussed metastasis mean progression of disease from a different joint to another indirect joint which is not directly in relation. So first there was joint pain and then suddenly it becomes cardiac complaints and then suddenly it becomes a piles. So maybe there is a suppression, maybe the patient has used any kind of ointments or any painkillers or any pills that suddenly suppress, suddenly decrease the symptoms, and for this the root cause of the disease remain there, but it tries to find out a different organ to affect, as because that organ is shaped by initially or temporarily shaped by different medicine. So this how our internal disease migrate from different part to part or metastasize different part to part. And if we found such symptoms, we can think of abrotonum. Or it can be rheumatism with suppression environments, then cardiac asthma. So there may be any kind of chest discomfort, dyspnea, shortness of breath, as a doctor can suggest with a case that there was a patient who had rheumatism and he used liniments or ointments, and because of which his knee pain suddenly decreased, suddenly become cured, and then he started chest discomfort. There he applied abrotanum, and the disease patient was cured for that. Or other dyspnea, not necessarily cardiac asthma, or chest discomfort or burning stomach pain, such kind of symptoms. Fifth, particular symptoms can be hydrocele of boys from other disease suppression. So maybe there is hydrocele due to suppression. Okay, so this can be a symptoms, or we have seen in case of mumps, it usually metastasizes to testis. Okay, so in that scenario, first choice of drug we had carbovage and pulsatilla. If they fail, then we can come to abrotanum. Okay, so this is one of the feature we must remember. And lastly, the relations, very important. The relations are just as we have seen, we have given hypersulfurin boils. If it do not works properly, that means there is maybe a suppression history. You can use abrotanum. Second is aconite and bryonia in pleurisy, but stitching pain remains. So that means that pleurisy may be patient unable to give the proper history, but had a suppression, or even in some cases where astrax and bryonia fails, then it calls for abrotanum because there is a hidden, I repeat, hidden history of suppression. Okay, so there we can think of abrotanum. And lastly, the third relation says when carbovagal pulsatilla fails in mumps followed by orchitis, we can think of abrotanum that I already have said. So this is all about abrotanum and the symptoms. If I summarize abrotanum in a very short format, you must remember one thing: there is a suppression, and because of that suppression, the disease metastasizes in another vital organ. This is number one. Number two, patient has good appetite, but patient is emaciating, and the symptoms of emaciations come in different way. And functionally, if you see, most common symptom where clinically abrotanum is used has been used much more. There is parectal bleeding, maybe due to piles or any other thing, hemorrhoids, suppressed, and rheumatism started, or alternate colic and limb pains functionally. So this was all about abrotanum. You study it more and more, try to engulf what it actually tries to say, memorize it, apply it clinically, you will find fabulous result. Okay, thank you. So this was all about abrotanum. Next day we'll study a different drug.